Hello and welcome again to Minds That Matter. I'm your host, James Thomas. And before I introduce our guest today, I'd like to let you know that we have a new event going on for Minds That Matter. We are now on YouTube. You go to YouTube, you go to Broadcast Yourself, and you put Riverwood Minds That Matter, and you will see this show that we have on today, and there might be another show on too. But for April, our guest today will be on the show. And every month we'll be letting you know that we're not only on cable TV, but we're also on the internet. So we're pretty excited about that. And without further ado, I'd like to introduce our guest today. He is the president and CEO of the East Bay Center. His name is Mr. Robert Crossley. Bob, it's good to see you.
Hello, Jim. Great.
It's been a long time.
It has.
We had you on, I thought we had you on 2 years ago. You told me you were on 4 years ago, which is amazing. And we've been running longer than that, I believe. So, but you've been one of our early guests, and now you're back. And we wanted to ask you, first of all, what's been going on in the last 4 years at East Bay Center?
Quite a lot. I mean, I think that when I got into the position 4 years ago, I had no idea what to anticipate or expect. Mm-hmm. It's been quite an active 4 years. There's been a lot of challenges. It's been interesting, and it's been a lot of challenges. With the downturn in the economy, the federal economy, the state economy, it's affected our Medicaid billing and our Medicaid income. It's also affected our state contracts with DCYF, with MHRH, for all of our indigent and our other services also. I mean, so it's been a challenge to really negotiate an increase in the demand for our services with our funding either remaining stable or getting cut.
So the number of folks that are receiving services have increased again over the last 4 years.
Yes. Probably last year by 10 to 12% increase in people coming to us. And a lot of it's been tied directly to the downturn in the economy. Folks with mild depression or moderate depression, anxiety, people who've lost their jobs, they lost their houses, a little bit of conflict in families because of the lack of money or lack of jobs. So you get more couples issues, family issues, children acting out in school, as they, become the symptom bearers for their families. Mm-hmm. So it's been pretty, our CSP population has been fairly stable. It's been our outpatient population and substance abuse actually increased that we've seen over the past, say, 2 to 3 years.
And what has this caused you to think about in terms of new initiatives or anything that you wanted to add to your array of services to help to meet the need that's going on?
Yeah, good question. I think that for I think a double reason. One is for looking at if our Medicaid and other funding streams are being affected by the state or federal economy. Mm-hmm. What other funding streams could we look at to help augment what we do for our clients? Also, when you look at the different populations or different kind of problems that we've seen lately, we've developed services to try to meet those needs. We've developed a partial hospital program, intensive outpatient program. We just got a license a couple of weeks ago to develop an ambulatory detox. And we've looked at special populations, for instance, like the LBG population, lesbian, gay, bisexual, where folks that are dealing with a sexual identity issue, whether they're children, adolescents, adults, we've noticed that. So we've developed services, for that population. So we've kind of been real sensitive to the let's say the wave of new requests we've gotten and tried to develop services in response to them. It's also boded for us very well on the financial end because we've been able to, again, like I said, not just develop new service lines, but with that tap into new funding streams to help, just kind of keep it all moving along.
Now, have you gotten grants for that kind of work, or have you built Medicaid for it, or how have you increased your revenue?
Some grants. Medicaid's been kind of stable. It's been more Blue Cross, United Health Plan, Neighborhood Health Plan, self-pay, consumer self-pay. And I must say that the city of East Providence and the towns we service, Barrington, Bristol, Warren, have been quite generous to the organization, but not to the organization for us, but to support their indigent constituents. The city and towns really have been sensitive to the increase in their constituents who've lost their jobs, who may be losing their housing, and how the city and towns can support them to receive services from us. Now, we do a lot of free care, but we also look at subsidies from them, and they've been quite generous.
So on their budget lines, East Bay Center is one of the budget lines,
right?
For both Barrington Bristol, Warren, and East Providence?
East Providence. Like I said, they've been quite generous, but I know that they're really suffering through this economic downturn also. So we've seen a slight decrease in the funding we get from them, but at the same time, it's still there.
Now, other centers have had to lay people off, have had to go to a shorter work week, have had to do all sorts of things. Have you been able to keep your constellation of staff pretty steady?
Yes and no. No, in the sense that we've downsized staff also, but by looking far ahead down the road of what might come our way, we've frozen positions. So we've done it through attrition. Okay. When we have an open position, we just freeze it and say, okay, do we need to hire this type of person again, or do we need another discipline do we need a case manager or a counselor or a doctor or a nurse? So what we've done is we've frozen positions as they become open. And you're in the field, so you realize that kind of hurts the service end of things, because then it takes a clinician out of, who had a client caseload. So it has affected services, but it hasn't affected our staff's job. So we haven't laid people off, unemployed people. Okay. So we've done our best to try to keep the staff we have, been real creative, looking down the road of what should we anticipate, and then try to take corrective steps and be proactive sooner rather than waiting till it's too late.
And I know that you've talked before about the idea that you are here to meet the needs of the consumers in your catchment area. Right. And to encourage, well, I don't know if it's encouraged, but to expect that the staff are to be out in the field and to be working with people in the community and to doing outreach if need be. But that's always been the way that East Bay has been, and they've always looked for resources. So how is that going in terms of philosophically? Are you still holding to the same kinds of initiatives that you've always had in East Bay prior to you being there?
Yes, we have, and I think that the one shift is more toward really promoting, emphasizing, supporting the concept of recovery, helping people to be more independent, more self-sufficient, less dependent upon us. At the same time, we'll always be there, so we'll always be the support person or the support network for our consumers, but really looking at how can we, like we're looking right now at how we can develop a consumer group within our organization for them to become mentors, for them to be a consumer leadership group, for us to work with us as staff to work with them, to then have them reach out to the rest of our consumers to be good, like consumers who have met with great amount of success. Consumers, like we have one person, she's been quite successful, she has schizophrenia. I mean, there was a time when she was in the hospital most of the time, or she wouldn't leave her apartment. Now she takes trips to the Caribbean by herself. Oh, wow. So in the way that she's made decisions to become more independent, we're hoping that a handful of our really successful consumers can reach out and be a consumer leadership group to be mentors and leaders for the rest of our consumers to realize what support and education do we have to give to the rest of the consumers to have them be willing to take a chance to have the life that they really should have, that it's really their life, and they may have been in the past afraid to make some decisions, or maybe not have been supported to make those decisions. So I think that yes, we still provide the array of services we always have provided, but with the nuance now and the emphasis on recovery, helping people make more decisions for themselves, by themselves, and letting them try to be more independent and self-sufficient.
Okay. Now, we had talked before we came in here about the notion of increasing the idea of vocational endeavors, of helping people to get jobs as part of the notion of recovery. I mean, for people to sit around drinking coffee, smoking cigarettes, and taking their medication on the couch is not necessarily quality of life kinds of stuff that goes on, nor is it sitting in a day program all day, drinking coffee, smoking cigarettes, and watching, When Harry Met Sally. On,
Wheel of Fortune.
Yeah, or Wheel of Fortune, right. So it's and MHRH has also put an initiative together about one more survey that's going to come out around vocational status of where we are sort of as a baseline as a state, and then where we need to be, because the last time they kind of evaluated us as a state, I think it was 12.8% of the folks that we serve statewide were in either some kind of vocational endeavor or were doing something around education and things of that nature. And SAMHSA has said, the feds have been saying that we need to be at 60%. Right. And we used to have the IPS program. There used to be an open door at the East Bay Center when it was East Bay Mental Health Center, where they had a psychosocial day program. But any ideas around how we can enhance the notion of recovery through work? Anything that you guys are doing at East Bay?
Just that what I could say to that is like 12%, as you identified, is pretty poor. So I mean that's a pretty low percentage, and you're right. It's right. It hovers right around that. We worked with MHRH is taking good leadership around looking at the whole service system, and they've developed a concept that they call the levels of care. We're involved in that pilot program. We have been for over a year now. It's going very well, and what we do through that is we work with Tom Martin, Richard Zabo, and some of the staff there to look at what are our outcomes toward recovery and toward job finding for our consumers. In fact, Tom was at our place last week to look at how we're handling the whole vocational piece. What we've done is we've really looked at collapsing our outpatient and our community support vocational resources to make one vocational department to try to craft, if you will, a one-stop shopping vocational program. So no matter who it is that comes to us, somebody who walks off the street, somebody who's in outpatient therapy, somebody who's a CSP consumer, they can all access these recovery/vocational services. And we look at it as trying to, like through Bob Drake's IPS model, look at how can we help somebody, how can we help them to be ready to make a choice to have more meaning in their life, whatever that means for them. So like take the person where they're at, and maybe if they are somebody who's sitting home all day long smoking cigarettes, watching Wheel of Fortune, well, they may be afraid to get a job. They may say, well, gee, if I get a job, I'll lose my benefits, or I could never work, or I'm too sick to work. So we look at, okay, what do you want to change? What do you want to change in your life? Is it where you live? Is it how many friends you have? Do you want a relationship? So we start off wherever the person is at, and then try to then move them forward with their readiness. So the ultimate readiness for us is, are you ready to get a job? But if you're not at that point yet, maybe there's a lower level goal that you're ready to tackle, and if you are and when you are, we'll work on that with you. And then as we do that and you meet with success, then we can slowly move the person forward to that eventual goal of independence, their own apartment, if they're living with a family member, and a job.